Good morning. Thank you for joining us for this COVID-19 update. Today is Tuesday, February 22nd, 2022, and this is Kathy Turner, Director of Communications for the Louisville Metro Department of Public Health and Wellness. Mayor Fischer is our host today, and joining him are Dr. Sarah Beth Hartledge, Associate Medical Director of the Louisville Metro Department of Public Health and Wellness, Dr. Christina Bryant, Pediatric Infectious Disease Specialist at Norton Children's Hospital, Misty Ellis, Pediatric Acute Care Nurse Practitioner at Kentucky Children's Hospital and board member of the Kentucky Nurses Association, and Dr. Sarah Moyer, Director of the Department of Public Health and Wellness, will be joining us a little later. I'd like to remind everyone to please mute your devices, place your questions in the chat addressed to everyone. Mayor Fischer, and I'll turn it over to you.
Well, thank you, Kathy, and good morning, everybody. We're going to be focusing on our youth here today and COVID. And as I was out and about here over this weekend, I had the opportunity to see a lot of young people enjoying various activities. Here's a shot of the new Louisville Metro Police Activities League. And then I went to the mighty shade of Ebony's super creative tricked out trash can program where they're seeking both social justice and raising money to keep our city cleaner. So that was good to see. The real young prodigies were with them at that event as well. And so just as we're seeing our downtown rebound with office workers returning, and we're seeing nightlife come back, we've also been finding new ways to navigate through COVID-19 without totally sacrificing our needs to be active and engaged with the community. So somewhat learning how to live with the virus. And obviously this is possible thanks largely to the vaccines and then people wearing masks and doing all the protocols that we're all so familiar with right now. There's no question vaccines are proven and they're safe. There's no question also that the amount of new people getting vaccines has slowed down, but we really still want to encourage people to get vaccinated to protect themselves against the virus. And if they do get a breakthrough case, they'll be in much better shape than they don't. So please hang in there, because I know in some ways this pandemic feels like it's dragged on forever. In other ways, really, when you take a look back a year ago, it's astonishing how much progress that we have made. Last year at this time, vaccines were in really short supply, and we had residents searching all over town, going to other towns to get the vaccine. Others wanting to know when their age group was going to be eligible for the vaccine. So we made a huge progress. Schools, obviously, we're back in session now. A year ago, we were in NTI. So just a lot of progress. And vaccines have saved countless lives. And now they're available to anybody that's age 5 and up. And even though young people tend not to get seriously ill, the vaccines can keep them from being sick at all and from spreading it to more vulnerable people like their grandparents or great-grandparents. So today we're going to talk more about young people, the virus, and vaccines. It's wonderful to see the increased availability of the vaccines to fight this dastardly virus. And I'm hoping that the downward trend of new cases will continue so that our community can continue minimizing the negative impact of the virus and then just kind of get back to a more normal life, if you will, learning how to live with the virus. I want to thank all of our educators, all of our healthcare professionals that have helped get us through this really treacherous time these past couple of years in America and around the world. So before we get into more discussions about the youth, let's get an update on where we are with the data with the virus. And to do that is our esteemed Associate Medical Director, Dr. Sarah Beth Hartledge, who has led us through so many treacherous chapters in this episode of the deadly pandemic. Thank you, Dr. Hartledge, for all your good work. What's going on?
Thank you, Mayor. So I'm going to start by saying that our labs and healthcare providers are sort of starting to catch their breath a little bit over as the case counts decline. And part of catching their breath means that some of our reporting is catching up this week with some of the very large numbers that they had in January. So we can get the dashboard up here. So we are showing 7,106 new cases in the last week. But as I said, there are quite a few catch-up cases in there, and our case count for brand new cases is 3,638. The incidence rate of 132 there is likely inflated a little bit as well from those catch-up cases. And I believe the true number to be closer to 105, maybe 110. Testing remains high, and our positivity rate is now down to 16.47%. We are showing 29 newly reported deaths in the last week. The New York Times had a big analysis this week showing that nationwide Omicron deaths outnumbered deaths from the Delta wave. And that just is a reminder that a small percentage, even a reportedly mild variant, a small percentage of a very large number is still a pretty big number. So we will continue to see deaths reported from the Omicron wave for a couple of weeks. Our hospitalization numbers are down some. We have 239 patients hospitalized with 53 in ICU and 30 on ventilators. Unfortunately, another number that's trending down is our vaccination uptake. You can see the graph is kind of trending down a little bit there on the right-hand end. So we do have 74.8% of our population that has received at least one first dose of a vaccine, which is awesome. But if you look at the bottom, the red line there, we have only 44% of our population who is fully up to date with their booster recommendations. So still a lot of space out there for folks to get vaccinated. And if we break it down by age, we've got a map here. If we take a look at this map, you can see that on the right, the blue map shows vaccine rates for age 60 and up. We know that our older residents were the first ones to get vaccinated. They took an early lead and they have never relinquished it. So pretty much every zip code is reporting 80% or greater vaccination in that age group. But if you look on the left, our young folks, this is age 5 to 18. And that age group, you can see that there are no zip codes above 80%. And it's much more varied across the area. So we have higher vaccine uptake in our kids on the east end than on the west and south ends. That's a trend that we saw with adults, and it took us longer to get those higher vaccine rates in that area with adults. So there's a reason to think that those numbers can and will continue to go up, but they are lower for some of our kids. And, like I said, the Omicron variant is considered to be milder, and for most people that's true, but you don't want to be the test case for finding a severe illness. And we do still have kids being impacted either directly through illness with themselves or through caregiver loss as well. So lots of opportunities for increasing vaccination. There are hundreds of places to get your vaccine or your booster across the area, including our community clinics. This weekend we'll be at Americana for our 20th trip out to that site. So this is a list of our community clinics, and you can also visit vaccines.gov or text your zip code to GetVax to get a full list of retail pharmacies, healthcare providers, and other places to get vaccinated.
All right. Well, thank you, Dr. Hartledge. And as you say, vaccines are in full supply all over the city and county. So please go out and get vaccinated. It's a good thing to do. You feel good about it. It's like a burden off your shoulders when you get the vaccine. So please go ahead and check it out. Okay, now let's talk about young people and the virus. So joining us today are Dr. Christina Bryant, Pediatric Infectious Disease Specialist at Norton Children's Hospital, and then Misty Ellis, Pediatric Acute Care Nurse Practitioner at Kentucky Children's Hospital and board member of the outstanding Kentucky Nurses Association that has helped us get through this virus in just exemplary fashion. So we really appreciate you all joining us here today. Dr. Bryant, if we could start with you. Can you tell us a little bit about your role as a pediatric infectious disease specialist and the work you've been doing during the pandemic at Norton's?
Sure, Mayor Fisher, thank you. So I'm a pediatrician specializing in infectious diseases. I primarily take care of kids who are in the hospital with infections, and that includes kids with COVID and kids with complications of COVID, like multi-system inflammatory syndrome. I've also been a part of the team at Norton Healthcare that has responded to COVID. So I've helped with policies and procedures and treatment protocols. And I've also worked to educate pediatricians in our system and in the community about what this disease means for kids.
Gotcha. And what's the big takeaway on that in terms of what the disease means?
Well, I think the big takeaway is that while many kids have mild or asymptomatic disease, this is still an illness that you don't want your kids to get if you can help it. And for kids who are 5 and above, this is a vaccine preventable disease. Parents can protect their children from COVID and the complications of COVID.
And when you talk to parents or their kids are not vaccinated, what's typically are you hearing?
You know, I think parents have questions, and that's okay. It's all right for parents to have questions. Many parents, um, first of all, thought, well, okay, this is no big deal for my child. What I tell them is that while many kids have mild or asymptomatic disease, historically, over the course of the pandemic, 1 or 2 kids out of 100 with COVID will get admitted to the hospital. And some of those will be really sick. They'll be in the ICU. About 1 in 3,200 kids with COVID are going to get multi-system inflammatory disease, which is life-threatening. It's not so common, but you can't predict if that will be your child. The second message is that we have a safe and effective vaccine for kids who are 5 and above. And hey, I understand some parents didn't want to be first in line, and that's okay. They wanted to sit back and wait and say, all right, I need to know more. But now across the country, more than 16 million kids, 12 to 17, have had the vaccine, more than 8 million kids, 5 to 11. We know the vaccine is safe and effective. And so now's the time for parents with questions to get those questions answered.
And are you seeing the same type of impact with kids as you see with adults of vaccinated versus unvaccinated?
Absolutely. So vaccination protects against severe disease. It is really uncommon for vaccinated kids to be admitted to the hospital for COVID, to be sick with COVID. So vaccine is protective. The CDC, you probably saw, released data last week that during Omicron, unvaccinated teenagers were 6 times more likely than vaccinated teenagers to get admitted to the hospital. And we know that multi-system inflammatory disease is much less common in kids who've been vaccinated.
Mm-hmm. And you guys have a pediatric long haul COVID clinic, I understand. What are you seeing with that clinic, and what are there different symptoms for kids versus adults with long haulers?
You know, it's really pretty similar. Since the start of the pandemic, we've seen about 125 kids with symptoms of long COVID, and the symptoms are really similar to what you see in adults. So fatigue, shortness of breath, um, anxiety, and depression, some of them just not feeling themselves. So it's very similar to adults.
And do you see any correlation between adults not giving their kids flu shots and not giving their kids COVID shots? Or that's where I struggle with a little bit, is you have adults vaccinating their kids for other diseases, but not COVID. Is it just the newness of it, or any observations about that?
I think there is some that's definitely a concern. Parents say, "Oh, this is a new vaccine. I want to learn more." There is some overlap with parents who haven't given their kids flu vaccine, but we're also seeing parents who've given their kids all of their routinely recommended vaccines, not taking their children in for COVID vaccine. So I think what we need to do going forward is really send the message, this is now a routinely recommended vaccine. It is a vaccine that is recommended for all kids 5 and above.
Gotcha. Okay. Any final messages you want people to hear?
Vaccine is safe and effective for 5 and above. And if you can protect your child from COVID with vaccination, do it.
It's that simple. Okay, thank you, Doc. Appreciate that. Okay, Misty, let's come over to you with waving the proud UK blue there in the background. Welcome to the call. So tell us a little bit about your work at Kentucky Children's Hospital.
Thank you, Mayor. So I am a pediatric acute care nurse practitioner. So that means that I specialize in acute care settings, in particular in intensive care, so pediatric intensive care medicine. My role, along with my colleagues, so pediatric intensivists, nurse practitioners, nurses, and respiratory therapists, care for children of all ages, so from infancy up to 21 years of age, that are critically ill. It could be various illnesses and disease processes, but we certainly see the sick of the sickest when we refer to the pediatric intensive care unit throughout the hospital.
Gotcha. And what are you seeing in the hospital relative to COVID, vaccinated, unvaccinated, various trends you might be seeing?
Sure. So unvaccinated children make up almost exclusively the children requiring ventilation or even special devices such as ECMO. I'm sure that folks have heard that terminology with our adult patients that we see with COVID. So we do see that in the intensive care unit. The more severe COVID cases at Kentucky Children's Hospital are from unvaccinated children. Also, it's important to note many of those children have underlying health conditions such as obesity. And so we have seen, especially early on with the virus in the pandemic, really sick children. It does seem to be we starting to catch our breath a little bit of recent, but certainly our role is to take care of those really critical patients with COVID.
And what kind of long-term impacts are you seeing with kids that have gotten COVID?
I think that, you know, we still see some of those patients with multi-system inflammatory syndrome. So basically what's happening is there's this huge inflammatory response that really attacks the whole body. So some people think, well, if I get COVID, it's just all in my lungs. But certainly children can get MISC and it can be, you know, affecting all of their organ system, make them really, really sick. And that requires sometimes lots of specialists. So kidney specialists, lung specialists, heart specialists, lots of providers caring for these really sick kids. And then, you know, some patients go on and have like long COVID, so prolonged symptoms, fatigue, cough. And we cannot, you know, forget the mental health side of this. Mental health has been a huge component with these children and adolescents. So when you're hospitalized for a long period of time, or if you're not in school, or if you're really sick, you know, the mental health impacts of COVID has been astronomical for children.
Mm-hmm. And are you hearing anything new from parents relative to their hesitation, the same kind of things that Dr. Bryant shared, or anything new to add to that? Or have you found anything convincing to get parents to, okay, go ahead and get their kids vaccinated?
Well, it's interesting, you know, parents, when they're in the intensive care unit, they go, you know, I knew my neighbor, you know, down the street had it, but I didn't think my kid would be this sick. I didn't think my child would be in the intensive care unit. And so I think for some parents, it's still trying to wrap around the concept that your child could be critically ill from a virus, you know, and, you know, just to add to what Dr. Bryant, you know, said, I think parents just want someone to partner with them. So if you're a provider in the community, you want to form partnerships with your parents. You want to be a good listener and acknowledge their concerns because they're real. You know, vaccine education is not a new concept for pediatric providers. If you poll any provider in your community, every day they counsel parents and have conversation and dialogue about the importance of vaccines. And so we as providers continue to stress the importance of vaccines and how important they are in preventing this illness. And I think the more we have good conversation and good information out there in the media, because I think sometimes that's confusing too, is that we need to make sure that we're sending consistent, strong messages about vaccines and the importance of them.
Very good. Okay, thank you for that. Thank you both for joining us now. Kathy, we'll turn this back to you for immediate questions.
Okay, thank you. So this question is from Sarah Ladd at the Courier Journal. Dr. Hartledge, I'll address this and her follow-up question to you. So she says, just to confirm, there isn't an uptick or plateau in cases, the decline continues. Is that correct?
So I'm going to jump ahead and answer both of your questions because the next one about positivity. So our positivity rate is now about 16.5%, which is down dramatically from the 33% we were seeing at the peak of the Omicron wave. The case numbers are also trending down. I would say that the downtrend is slowing a little bit. We have about 3,600 new cases in the last week. So whether that is a plateau or a continued slight downtrend is hard to say exactly, but I do not believe that there is an increase in cases this week. I believe that our laboratory partners are sort of catching their breath and catching up a little bit with the January data that they got so far behind from the volume.
Okay, thank you. This next question is from April Rickert of WFPL. Dr. Bryant, I'll address this first to you. How do you determine that kids have long haul symptoms and not another illness? What should parents look for?
So long COVID is, the CDC has a nice definition, which really is symptoms that persist after, let's say, 6 to 8 weeks, when you think that the kids really should have been better. One kind of tricky thing with long COVID is that there are kids who have persisting symptoms who had really mild or even asymptomatic disease. And so if parents are concerned about long COVID, one thing to know is that there is no test to be able to say, aha, these symptoms are due to long COVID. The best course of action is to see your pediatrician or nurse practitioner or primary care provider to talk through your concerns, and they can look for other things that might be causing the symptoms. I will say that we've had some kids referred to our long COVID clinic that upon careful evaluation, they were actually had a different virus. But this does take careful evaluation.
Okay, Misty, anything else you want to add?
No, I think I just would echo Dr. Bryant. I think that, with children, oftentimes they can have multiple things going on. And to her point, just careful evaluation. And it's never wrong as a parent to seek medical advice. That's what primary care providers are for, to be there for you and to support you as a parent. And so to always seek out information.
Okay, thank you. And I want to ask, April had a follow-up question. Dr. Bryan or Misty, if you could address, do you know what percentage of kids who get COVID end up with long haul symptoms? And does being vaccinated make it more likely to get being unvaccinated, make it more likely to get long COVID? Dr. Bryant, you want to address that?
Sure, I'm happy to start. So I think we're still learning what percentage of kids with COVID will develop persistent symptoms. And so the NIH is doing a big study and following kids with COVID, and we'll know that. I think we do know that it's not common, and most kids ultimately recover. I do think that we are also learning that vaccinated kids in general do better on all fronts with COVID than unvaccinated kids.
Thank you. Anything to add, Misty?
No, I think some of the information in the pediatric world, we're just still having, need time, to sort through the data and monitor these children from a long-term perspective. Certainly those children, though, that are in intensive care settings can have significant chronic illnesses and require rehabilitation following their intensive care stay. So that is something to note. And again, the majority of those patients are unvaccinated that are in intensive care units.
Okay, thank you both. This next question is from Jose Donis of Aldea. Dr. Hartledge, do you have any comments or information about the BA2 variant? NPR reported yesterday that scientists are on alert because the new variant is more contagious than BA1. Has it been detected in Louisville or Kentucky?
We have detected the BA2 variant in wastewater at a low level. This week, there is none. So last week we had some at a low background level. This week we do not detect any. So my suspicion is that we do have it here locally, at least in the background. We do not have any confirmed cases in people yet. It's a little more difficult to test for. You can still tell that the patient has COVID, but it's a little more difficult to determine that it's BA2. And so that can limit the number of cases that we see. So we haven't seen it in a person yet. We have seen it in wastewater, but we're not seeing any this week. If we don't have it yet, we will have BA2 around before too long. And the data out of other countries and other parts of the United States suggests that it is more contagious. There does not seem to be any additional severity associated, but as we learned with BA1 and the Omicron wave overall, that just having a very large number of cases is a significant strain on the hospital systems. A small percentage of people will get very sick. So we want to keep an eye on that. You're exactly right. We're keeping an eye on it, and we look for it in wastewater every week, and we are testing for it in humans as well.
Okay, thank you. This last question is from Sarah Ladd with the Courier Journal. With Jefferson County rate of positive cases higher than the state's, is the health department still confident we can leave the red zone a week before the rest of the state? Dr. Moyer, I see that you have joined us. Would you like to weigh in on that question?
I sure can. I one, with COVID, never confident about anything. We're still learning more every day and never know where it's going to head. So we did peak before the rest of the state, which made me hopeful that we would decrease before the rest of the state. But as you see, we're having a slower downtrend. But I think as soon as we get caught up with the labs, hopefully we will still be on track for that.
Okay, thank you, Mayor Fischer. That was our last question.
All right. Well, I want to thank Dr. Christina Bryant for joining us here today, and Misty Ellis as well. And of course, our great public health and wellness team as we navigate through the virus. We definitely are hoping we are on the decline. We just want it to be moving faster now. So everybody continue to do their part to spread the word. We appreciate the media being partners in this effort as well. And we'll look forward to seeing everybody next week. Thank you.